If you've undergone ACL surgery, or if you're not going through ACL surgery and you're wondering, should I use a brace? Is this necessary for me? How do I get it? And who do I talk to find out if it's the right thing for me? This video is going to help you. My name is Dr. Garcia. I'm the CEO and founder of Sports Performance Physical Therapy, where we help people just like you overcome these types of injuries and get back to the life that you want. So if you have an ACL tear, or if you've had an ACL surgery, it's very common that you might want to use an ACL brace. They're a hinged brace. They stabilize the knee and they protect it from excessive movement, especially if you don't have an ACL anymore, or if you just had it repaired and you're trying to make a return from rehabilitation back to soccer, tennis, whatever life things that you want to enjoy. So I wrote 3 things down for you to be able to help you decide if this is for you. And a lot of times this comes down to your personal preference, your surgeon's considerations, and then how comfortable do you really want to be and how fearful are you of this re-injury. So here are the 3 things to consider. When do you begin to use this? Well, typically after surgery. This is very common at the 12-week mark when you start to run, if not at the 16-week mark, when you begin to return to sports, where you return to cutting, pivoting, maybe playing tennis or baseball or whatever sport that you enjoy. This is all based on the surgeon's personal preference. But if you want to be an advocate for yourself and you feel like you're a little bit more conservative, you want to make sure you're doing the right thing, an ACL brace, a common brand, is called DonJoy. This is different from the knee brace that you got after surgery. The one after surgery just keeps it locked. It doesn't allow it to do much. Its main job is to stabilize that knee. These DonJoy return to sport functional knee braces provide a similar level of stability, but they have a little bit more give, and they allow you to pivot and move with having the ACL or the knees stabilized as much as possible. So you'll typically talk to your surgeon, and it might be covered through your insurance. At the 12-week mark, you'll get fitted. And the reason why they don't do this sooner is because as you heal from an ACL tear or ACL surgery, you lose a lot of muscle mass. So your thighs actually become a little smaller, and you'll see that in people who've had it. If you look at the other leg that didn't have surgery, it's a little more muscular, more firm. And the ACL side is a lot thinner, and that's because it hasn't been used for weeks to months, and this is now allowing the body to heal. So if we now create a custom knee brace for you on a small leg, as you grow and develop muscle around that new brace, you'll find that it won't fit you anymore. So they'll try and do this around the 12 to 16 week mark, purely because you've now developed the muscle mass very similar to the other side. A lot of the markers that they're going to look for is the muscle mass 90% compared to the other leg, and that helps them decide if you're ready or not as well. Now you'll talk to your surgeon, you'll ask them for a functional knee brace or after an ACL knee brace, and you might have seen these on TV with professional soccer or football, and they're very functional. They are a little cumbersome, but it's better to have that safety and stability. So you'll get fitted for them, and it might take them 1 to 2 weeks to get the knee brace to you, and you'll wear it. So I answered, when do you typically get it? At the 12 to 16 week mark. Now, how often do you wear it? You'll wear it every time that you're moving the knee in a particular direction that might be compromising. So you'll typically wear it in physical therapy or rehab when you're going through the exercises, just so you can get that comfort level. And you'll for sure be using it when you start to run, pivot, cut, and turn. Now, they might have you use it with running in a straight plane. A lot of people may or may not, but it's okay. It's up to you and how comfortable you feel. Once you do that, we figured out, okay, you're gonna get it at the 12 to 16 week mark. You'll have to wear it anytime that you're moving in a different direction, maybe even running forward, just to get used to the brace. So we answered when you're gonna start, how often, and then where do you get it? You're gonna get it typically through your insurance. Now, if you don't have coverage for that insurance, you may have to pay out of pocket, and you'll have some reimbursement through your insurance maybe. But ultimately, that's typically where you're gonna do it. You can also get it through the source at DonJoy, but they're gonna want a medical representative to be able to help you through this process to make sure it's fit properly. Now, if you find that your ACL brace is loose or it wobbles quite a bit, you're going to have to talk to the representative. You'll have a physician extender, someone, a nurse, or someone in the office who can help you fit them a little properly, or maybe it was too big when they fitted you. And then if you find that the Velcro is now coming undone or it's been stretched out, that's something for you to either get those replaced or get a new knee brace. These are all considerations that when you're deciding, is a knee brace for me? How do I get it? When do I get it? How often do I wear it? This video is great for you. It's a great resource to be able to help you, point you in the right direction. We help clients and patients and athletes just like you throughout all over the country at our locations in San Diego. We help people be able to overcome these things, and an ACL brace is very common what we see. Good luck on your rehabilitation journey. If you have any questions, feel free to reach out to our team at any of the contact links below. Good luck.